what has been my experience working with JIPA? Joint Independent Providers Association was brought in by the government of St. Lucia to work with the Universal Health Coverage Project under the Ministry of Health, Wellness, and Elderly Affairs in St. Lucia. What I can tell you is that JIPA has a wealth of experience, and that we really needed on board, seeing that we're starting the services under universal health coverage, and we really need to find a way to sustain finances. How do we finance the services we want under universal health coverage? So they were brought in to work along with universal health coverage project, focusing on financing universal health coverage. So far, the journey has been very exciting. They're easy to work with. I can say there's a team that's easy to work with. They're a team that you can get access to them easily. You know, the team members, you may very well have a doubt or you have a query, you want to clear up any issues. You could call them, and one of them always available to reach out and speak to you and to help you in that situation. Sometimes they go beyond and handle matters that does not even fall within the terms of reference, but they just want to help out to make sure that you're okay and that universal health coverage is something that St. Lucia can attain by 2030. We also looking at the fact that they're culturally sensitive to us in St. Lucia. We're a small island, and it's nice knowing that you have consultants that are from another small island or from small islands themselves. They have experience working in bigger countries. They have worked in bigger countries, but they also work with smaller islands. And therefore, when you speak of your difficulties, your challenges, your gains, your successes, they understand that our limitations, and they can work to ensure that we do what we're doing in phases, and we understand what we're doing, and the resources are there, how we manage our resources to make sure that it happens, and that's very good for us. So it's just not informing us of what's happening in the universal health coverage, but also you sense that they feel the situation on ground and they can work with us. They're with us regularly. They come here every month. They're in St. Lucia on the second week of the month, which works well for us because then they form part of our team and they integrated in what we're doing. And that's very good. The word JIPA itself means Joint Independent Providers Association. They've started working with us, and it's quite interesting that we were able to network and deal with other providers out there, you know, whether we have other places you can actually get patient care, other things you can do, other providers. It's a network. So being just starting to discuss UHC financing with them and UHC on a whole, we're able to piggyback on some of the things that already exist under JIPA so that persons are not disadvantaged. So they're working with us on the health financing policy, and they've done that. And right now that policy has reached the point where we have different drafts of legislation. And we've actually on the third draft right now, which is pretty much close to what we want. So hopefully that it will move from there into Parliament so it becomes a legislation. In that whole bill, which is the UHC bill, there are also discussion of the UHC authority. So we have documents on the authority, what the authority structure should look like, registration, what registration should look like so that persons benefit, and a lot of more discussions on how we're funding the UHC and the different persons and the different contributors to that fund, and how no one will be left behind, and even persons cannot afford after means testing how they receive the healthcare they need. So it's quite an interesting journey. For me as a director of UHC, I can speak about me and my team. It's a learning experience. I think it gives us the relevant tools that we need to move further, rather in attaining universal health coverage, and also for the wider solution. So I think it was a very good idea to have them work alongside us so they can push UHC financing with the wealth of the knowledge that they have gained over the years of experience as a company. Thank you.
JIPA Network, your connection to affordable global healthcare.